Hi, I'm Simon. I'm one of the dentists here at Thornbury. I offer anything from complex rehabs through to more basic kind of getting people back on the road when they haven't seen a dentist for a long time, and really enjoy seeing nervous patients and people who need a whole range of work from not a lot through to full rehab work. I handle a range of straightening cases, and my main passion with it is to try and look more than just straightening the teeth to make them look pretty. Often when you put them in the right place, form and function follow each other, but I really like to make sure that we're not just straightening teeth for the short term, but we're putting them in a place that looks good and then putting them in a place that's going to function well for you for the long term. You'll see less chipping, less wear, and hopefully a result that lasts for as long as possible for you. We see a couple of common problems. The first, which is obvious to most people, is that crooked teeth means it's harder to clean. I often have patients saying it's really hard to get teepees or floss in this certain gap, and I'm always getting build up there, so straightening them is going to help with that. The next thing that we find is that teeth where the bite isn't ideal or textbook, that's going to come together in a way that's going to put pressure and force on teeth as they're not meant to be put force onto. And so what that means is that we see, for example, lower teeth chipping and wearing a lot more than we might see in the average patient. And so by straightening those teeth, building them a little bit of room and getting the bite more even, we then see less chipping on those teeth in the future. There's a bit of evidence as well that we're going to see muscle tenderness, seeing people with headaches, migraines and other issues. And so hopefully a bite that's kind of more even and smooth will result in more comfort and teeth that last longer. You're definitely never too old to have aligners, and it's a brilliant treatment as we get older. We often see the teeth continue to crowd into our 40s and 50s and 60s. I absolutely love treating people in their 50s and 60s where we see a brilliant result and then try and keep it as it is for as long as possible, as those people have maybe had straightening before and have gradually noticed it all fall back on itself. Here at Thornbury, we really like to make the most of all our tech to give people the best experience and the most modern care possible, and that's the same with aligners. So here we'll make sure we've got fantastic photos and scans, take brilliant records and x-rays to give a really decent plan, and that means that you know exactly what you're getting from the start. You don't have to commit to anything before knowing exactly what the plan is, where the teeth will end up, how long it might be likely to take, and you'll be able to see this all on the computer screen simulated before you then commit to making any big decisions. With a consultation for straightening here at Thornbury, it's a lovely environment and it's one of the nicest places to come. It's a modern clinic, nice and relaxing, and so from the start you'll be able to hopefully relax into the process and get to know the team. We want to get you feeling comfortable before then giving you a really comprehensive look. We're not just going to look at teeth straightening, although that will be our focus, but we really want to make sure we're looking after you as a person, taking scans and photos so that we can send off for this digital planning and explaining your next steps.